Hello, my name is Jules and I'm a end-of-life care facilitator at my local hospital in Shropshire, and I am also a proud ambassador for the Good Grief Trust, and I just wanted to talk to you for a couple of minutes about the importance of kind language when looking after and supporting people who have got loved ones at end of life, or sadly their loved one has died, and also to help people come back to work after a loved one has died. And that support that we need from our colleagues is so important. So for me, with kind language, we really shouldn't be using the words body. We should be saying person. We should be saying the name of the person. It is so unkind for people to say, when somebody has died, would you like to come and view the body? No. We visit the person when they are alive, and we visit them when they have died. And kind language can make such a difference. So it's really, really important that we use the person's name if we can, and say, would you like to come and visit, and say your goodbye. So I'm hoping this little film might help the police force, also the ambulance staff, and maybe even undertakers, mortuary staff, NHS staff, but whoever it helps. I hope it makes a difference for one person. Also in hospitals, we always use the words having difficult conversations with relatives, which they are tender conversations, important and honest conversations. If we say that they're difficult, sadly, people might put them off, and we really need to make sure that they do happen. So by calling them tender conversations, that Kath Mannix uses a lot, and I like to say open and honest conversations. And supporting people after they've had those conversations would really help. And when staff come back from being off sick, a lot of people I talk to say that their colleagues didn't say anything about their loved one dying, didn't have that conversation with them, avoided them. And that's not kind. So I'm trying to, by doing this, and I hope to do more of these, will give you some tips. And the best thing to say if you don't know what to say is say, I am so sorry, I don't know what to say. It must be so difficult for you. I can't even consider how hard this must be for you, how difficult it is. But please don't say, I know how you feel, because you don't. Even if they have lost their father and you've lost your father, the relationship they would have had with their father may be different to you. We do not understand. Grief is individual, and we need to support people, and you have waves of grief. So you might have one okay day and the next day you can't stop crying, and that is normal and natural, and we need to tell people that. But when people come back to work, it is really tough for them, and we need to support people in a kind and compassionate environment. Really, really key. You know, things like carrying tissues around with you and offering tissues to colleagues is really important, and signposting them to the Good Grief Trust, which they have over 800 charities under that umbrella. So Child Bereavement UK, so many places that can help and support, so you can refer on, signpost. But they really want to talk, they want to be listened to. They don't want to hear about what's going on with you and your story when they've plucked up the courage to talk to you about their loved one and how much they miss them. So they really do need to be listened to, and I can't emphasise that enough. So I do need to touch on the police force and when they're dealing with suicide, and please do not use the words commit suicide. That is such an old-fashioned, out-of-date term. They took their own life, and it's heartbreaking for the family that are in that situation. But to use kind language and say their name and allow them to come and say goodbye to them if that's appropriate to do so, and be open and honest with them how they look. But if they want to go and say their goodbyes, then we should support them to do that. So I'm here because my best friend took her own life, We always apologise for crying, but we shouldn't, because it's you know, it's normal and natural. I'm talking about my lovely best friend Janet, who died in February 2019. She was beautiful. She was a nurse. She was beautiful inside and out, and the kindest person I ever knew. And part of me will never be the same, because I miss her every day. But please, you can't take away the pain of us losing people, but you can make it easier for us. You can make it kinder. Please use kind language. That's all I ask. Thank you. Bye-bye.